Hello everyone. So most of you are going to be familiar with the subpalpebral lavage system. So obviously we often put these into horses which are difficult to medicate, as it makes it much easier and they're often much more tolerant of it. So what we're just going to go through today is how to administer the medications, again as most of you know, but also how to deal with some of the problems that come up as a result of behavioural changes with giving the medications over time. So the reason why we're doing this video is because with several days or weeks of treatment, most horses will start to learn that the administration of medication leads to irritation of their eye, and they start to develop problem behaviours such as throwing their head, such as spinning around you in the box, or stamping or biting around at you. So the whole purpose of this exercise is trying to reduce those behaviours from developing in the first place, and it's best to try and instigate that from the start of treatment where possible. Because when they develop these behaviours, then it's very difficult to then adjust that to stop them from occurring. So there's a couple of techniques. So there's something called positive reinforcement, which is basically giving something which the horse finds positive in order to reinforce the behaviour. So Alifair has been doing here is whenever the horse does what we like it to do, is she's going to give the horse a treat. So that's a positive reinforcement. The next thing we would do is negative reinforcement. Now don't take negative as something that we're doing negative, i.e. hitting the horse or doing anything like that which is negative. What the negative stands for is we are removing something, which then leads to a positive association with the medication of the eye. So positive is giving something, negative is removing something. So what we're going to do here with the negative side of things is most horses, when you come to their side of their wither here, they then start showing their behaviour where they do their head tossing and they do other types of behaviours. And what we want to do is keep our hand in place until the horse stops throwing their head or showing that behaviour. So we're just going to keep this in place. We're going to use negative and positive together, and when our patient stops throwing their head, I'm going to remove my hands and Alifair is going to give the treat. The important thing in this exercise is don't remove your hand until the horse stops showing that behaviour, and don't give the treat again until they stop showing the behaviour as well. So our patient here is actually being quite good, just showing some mild head tossing at the moment. So I'm just going to do our last medication with our patient here. So again, as you all know, if the injection port is at all dirty, it's worth wiping that over. So we're just going to apply that in. So you can see that we're already getting a bit of head tossing here, so I'm just going to stop and just hold there. And when he stops throwing his head, I'm just going to remove my hand and Alifair is going to give a treat again. So he's just stopped throwing head, he's relaxed, and Alifair is going to give a treat. So just trying to build a positive association with this. And I'm just going to inject the medication slowly here. Obviously now not throwing the head around. Now going to inject our air, which we're using about 2 mils of air. And the really important thing is to do this very slowly. Again, we're just getting some head tossing again here, so I'm just going to remove pressure there, and then Alifair is going to give a treat again. Perfect. So again, nice and slowly with the air, very gradually, and that's that. So I'm just going to keep my hand in place there until it stops throwing head. So I'm going to remove my hand, and Alifair is just going to give a treat. So we're just trying to build this positive association with how the medication is done. It doesn't work in all horses, and it is very difficult to do on your own. So there are limitations to it, but if we can try and work towards doing this, then it's going to benefit most of our patients.